Fowl pox is a viral disease of chicken, turkeys, and other birds, distinguished by cutaneous lesions on the head, neck, legs, and feet. It has a worldwide distribution and affects birds of all age groups, except the recently hatched. When it comes to transmission, the virus is present in the lesions and in desquamated scalps. It is resistant to environmental factors and persists in the environment for many months. It usually infects birds through minor abrasions. Mechanical transmission occurs by cannibalism. Some mosquitoes can transmit the virus from infected to uninfected birds. The virus can be also transmitted by injury to the skin. There are two forms of lesions that are recognized: the cutaneous, which is the dry form, and the diphtheric, which is the wet form. When it comes to the cutaneous form, the dry form, there is number one, low mortality. There is lack of flock vigor and weight loss. There is a mild to moderate loss in egg production. Scaby lesions on the head, neck, and unfeathered parts of the skin. Let's look at how it looks like in the diphtheric form, that is the wet form. You will find number one, mortality low to moderate, difficult breathing, nasal and ocular discharge. The following stages of the pox lesions, papules, vesicles, and pustules, may be observed. In the cutaneous lesions, you will observe 1. Papules are light-colored nodules, and then the vesicles and pustules are raised and commonly yellow. Now, in the diphtheric lesions, you will observe buff to yellow plaques on mucous membranes in the mouth, esophagus, and upper respiratory tract. Also, occlusion of trachea and death due to asphyxiation. The other thing you need to know is carcass affected with fowl pox is condemned if progressive generalized lesions in a bird are accompanied with emaciation. Fowls with localized lesions and recovered birds are approved after the removal of scales. Fowl pox can be treated, but it can also be avoided. You can minimize the dangers and effect of fowl pox by immunizing your birds early on when you bring them into your poultry farm. Fowl pox can be treated and your birds can recover very well. If you watch our previous video of a chicken farmer who we visited, at the time we visited her, she was treating fowl pox. Her birds, the broilers, were suffering from fowl pox. And I visited her this week. It's like 2 weeks after we filmed, and the birds had fully cleared. Yet by the time we visited, they were still in the middle of the struggle to recover. Some were bad love, some were on their way to recovery. But this time when we went back, she had sold off almost 80% of the birds because they all recovered well and they were looking healthy again. So fowl pox can recover. You can visit your poultry farm, your local area where you buy your poultry medicine, and you can be helped.